So good afternoon, good morning, good evening to all our guests who have joined us for today's webinar. Welcome. My name is Nell Morojele, and I'm a member of the Department of Psychology at the University of Johannesburg, and also of the International Confederation of Alcohol, Tobacco, and Other Drug Research Associations, ICARA. I'd like to welcome you all to this fourth webinar in our webinar series on COVID-19 and substance use. So today's webinar is titled How COVID Has Changed Cannabis Markets, Use and Policy. And today's webinar is curated by the International Society for the Study of Drug Policy and chaired by Dr. Rosalie Pacula. So this is our webinar series is being run by ICARA in association with the Department of Psychology at the University of Johannesburg. And we'd also like to indicate that this webinar is being sponsored by the Society for the Study of Addiction, SSA. We're most grateful to SSA for their generous contributions. And without their support, this webinar series would not have been possible in its current form. So we thank you very much. So before we begin, I'd like to express my gratitude to a number of individuals who have assisted to make this webinar possible. So they are Ms. Lebogang Ramalepe from the Department of Psychology, the team at the University of Johannesburg Library for their assistance, headed by Ms. Balisa Tlatsi, and my colleagues and fellow members on the board of ICARA. So thank you very much. So ladies and gentlemen, I'd like to go through a few instructions before we start on how we'd like to run the webinar. So first of all, just to remind you all that the webinar is being recorded and live streamed on Facebook. So by attending this webinar, you're giving permission for this webinar to be recorded. Secondly, in terms of videos, we ask that when you speak, you keep your videos on, so that will apply to the speakers. And then thirdly, you'll have an opportunity to ask questions of the speakers, and you can do so either by using the Q&A function, where you can write in your questions, or you can also raise your hand. So we really hope to have a very lively discussion with yourselves and the speakers. You'll definitely have a chance to ask questions at the end of each person's presentation. And then finally, I'd like to make one small request. At the end of the webinar, we're going to ask you for your feedback. And so what's going to happen is that a poll sheet will pop up on your screen. We'd really be delighted to receive your feedback on this webinar, as we hope it will be useful for us for the future. So I'd like to end here and just thank you once again for attending today's webinar. We really look forward to an exciting webinar. I'm sure you'll enjoy it. And now what I'd like to do is hand over to Professor Nee Fitzgerald. So they are Ms. Lebogang Ramalepe from the Department of Psychology, the team at the University of Johannesburg Library for their assistance, headed by Ms. Balisa Tlatsi, and my colleagues and fellow members on the board of ICARA. So thank you very much. So ladies and gentlemen, I'd like to go through a few instructions before we start on how we'd like to run the webinar. So first of all, just to remind you all that the webinar is being recorded and live streamed on Facebook. So by attending this webinar, you're giving permission for this webinar to be recorded. Secondly, in terms of videos, we ask that when you speak, you keep your videos on, so that will apply to the speakers. And then thirdly, you'll have an opportunity to ask questions of the speakers, and you can do so either by using the Q&A function, where you can write in your questions, or you can also raise your hand. So we really hope to have a very lively discussion with yourselves and the speakers. You'll definitely have a chance to ask questions at the end of each person's presentation. And then finally, I'd like to make one small request. At the end of the webinar, we're going to ask you for your feedback. And so what's going to happen is that a poll sheet will pop up on your screen. We'd really be delighted to receive your feedback on this webinar, as we hope it will be useful for us for the future. So I'd like to end here and just thank you once again for attending today's webinar. We really look forward to an exciting webinar. I'm sure you'll enjoy it. And now what I'd like to do is hand over to Professor Nee Fitzgerald, who's the president of ICARA, and she's going to be introducing ICARA, and of course this webinar as well. So we hope you enjoy this webinar, and thank you very much once again for joining us. Thank you.
Thank you very much, Neo. So welcome everybody on behalf of ICARA to webinar 4 on how COVID has changed cannabis markets, use and policy. Policy appears to have dropped off my slide here. But that's a critical part of it, seeing as this webinar series is curated by one of our ICARA members, the International Society for the Study of Drug Policy. You're very welcome. I am president of ICARA and also professor of alcohol policy working at the Institute for Social Marketing and Health at the University of Stirling and deputy director of the Spectrum Consortium in the UK. And I'm really delighted to welcome you to this webinar series on behalf of ICARA. You may not have previously heard of ICARA. We are an umbrella organization, so our members are research organizations, societies or teams around the world that are focused on alcohol, tobacco, other drugs or behavioral addictions. And our mission is to promote, support and enhance research on these topics, both nationally and internationally, through supporting and facilitating professional exchange, collaboration and other activities. We have a particular focus on capacity building and believe in peer-to-peer learning within and between countries. And we're an apolitical, non-governmental organization. In terms of our current membership, it's quite diverse. So we have a lot of international bodies like ISSDP that are members of ICARA, but also national associations. And I'll just show you in a little bit more detail our list. I don't expect you to be able to read all of these, but you can find out more about any of these organizations on our website. We have a member directory there with a named contact for all of our members and also a link to their own websites. But you'll see just a flavor of our sort of full member organizations that themselves have individual researchers who are part of their membership. So that includes people interested in a whole range of topics, but also people in particular roles, so journal editors or librarians and so on. And then you'll see that we have national organizations that are also part of our membership. And I suppose fundamentally, we believe that there is sort of shared challenges and learning that can be, that we can benefit from discussions and collaboration between research teams and societies. But we are also open to associate membership from, for example, consortia or teams or organizations, for example, Alcohol Change UK commission research rather than conduct it, though they do some research themselves as well. And in terms of what we offer to our members, we, I suppose, really can help members to access a global audience. So my main area is alcohol policy, but I do have a passing interest in cannabis policy as well. I might not therefore join an organization as an individual member that to sign up to be a member of an organization like ISSDP, but I would still be interested in hearing about the events. And so there's an opportunity through ICARA to disseminate information from one member organization to the members of the others, and I think to kind of share information that way. We also can obviously support just getting information out around letter campaigns and generally just reach more global audience for our national association members. And I suppose what I was saying earlier really is the sense that we share common challenges as international and national networks. We are often all working as volunteers, maybe with a very small secretariat to support our organizations. We face similar challenges in terms of communicating with members during the pandemic has really illustrated that. And you know, we, like other organizations, have had to reschedule our annual meetings as a result of the pandemic. So I think just being able to discuss those challenges for our organizations, but also for the research that we conduct has been really beneficial over the course of the webinars that we've run so far. And we also produce guidance from time to time, most recently guidance not telling our members what to do in relation to management of relationships with commercial organizations, but perhaps advising on how they might come to a decision on what to do and how they might come to a policy that works for their own individual circumstances as an organization in terms of managing those tricky situations and decisions that sometimes have to be made. And that is available on our website. So fundamentally, we believe in the value of bringing researchers together to discuss and share their values and interests. So if you aren't already familiar with ICARA, and you're maybe not already a member of one of our member organizations, then I would encourage you to have a think about whether you already have networks or research associations in your country or your region that you can join to get to know and share work with colleagues with similar interests. And if you don't already have that, do you have opportunities to get together or to advocate together from which you could develop something like a network? And we're very aware that perhaps a majority of countries in the world do not have a national organization or a national association for researchers working in this field, and that we would really like to connect up individuals who are working in this area around the world who are thinking, actually, I would really like to be able to establish some mechanism to share learning with others in my country who are working in similar areas, but we don't have that infrastructure at the moment. And we'd like to be able to link you up with more well-established research or associations that are our members, and to provide that support. So please do get in touch if you're, as an individual, feeling as though this is something that you'd like to be able to do more of. So just very briefly to introduce you to our board, we are a volunteer run. Neo, you've met earlier. Matesh Kosier will be coming in as president in a few months' time. And then we're very lucky to have representation from across the world in terms of our members. And I'm very grateful to them all for their support with publicizing this webinar series and supporting it in other ways. We are also looking for new board members for 2021 to 23. So a little plug for this: if you share our enthusiasm for the value of connecting researchers nationally and internationally and would like to give some time to helping ICARA and in so doing benefit in terms of growing your own network and profile internationally, please do consider inquiring of me or of any of our board members in terms of what we're looking for. You don't have to be a professor, you don't have to be even from a member organization. Our board members are elected as individuals, and we very much welcome early career researchers. And if you don't feel comfortable taking on a full board membership role, there is an opportunity to shadow more senior board members in their roles as well. So if you'd like to know more, please get in touch. But enough about us now. I'm sure that you're here to hear more about cannabis policy and the impact of COVID on that field. Just a very brief flag to say that we have two more webinars to come, the number 5 and 6 actually in July and August, both focused on alcohol policy, probably in terms of the topics that have been chosen by those curating them. So a group of colleagues in South America and the Caribbean are working on a program for one at the end of July. And then I'm working with colleagues in Australia and South Africa on a program for one that will probably be at the end of August. And just to say that the final 2 webinars will be supported by Scottish Health Action on Alcohol Problems and the Scottish Alcohol Research Network. So we're very grateful to them also. So I'll finish just with thank yous to all of our chairs and speakers today. A particular thanks to our University of Johannesburg colleagues who have been very patient in terms of their coordination and support putting together this webinar. Our website information is there if anybody wants to know more. I'm also very happy to be in touch.
Well, thank you very much, Neem, and thank you for the introduction to ICARA, because I do think that this is an organization that many of our ISSDP members are not as well informed about, but are likely to be very interested in. I just want to say hello to everyone. I am Rosalie Liccardo Pacula, the president of the International Society for the Study of Drug Policy and co-host of today's webinar. We are very excited to have 3 of our distinguished members of ISSDP who have been studying the impact of COVID-19 on cannabis markets, and we'll be discussing some of their research in this area today. The first person, I'm going to introduce all 3 of our panelists, and then I'll give them 7 to 10 minutes to talk about their research, and then we are excited to engage in what we hope will be a very interactive and deep conversation about the impact of COVID on cannabis markets. Our first panelist will be Judith Albridge, who is a professor of criminology at the University of Manchester in the UK and the George Soros Visiting Chair at the Central European Universities in 2017. She took that chair. She has been studying illicit drug markets and drug use for decades. And in recent years, her research has focused on how drug markets have been facilitated by technological development supporting anonymous internet activities in the form of so-called darknet drug markets. So she has a lot of interesting insights about how these markets have evolved and changed even with COVID. Judith is a member of the UK Government Advisory Council on the Misuse of Drugs and has acted as an expert capacity with organizations that include the European Commission, the Pacula Group, and the Council of Europe, as well as the European Monitoring Center for Drug and Drug Abuse. So we are very grateful to have Judith with us today. In addition, we have David Hammond, who is a professor in the School of Public Health at the University of Waterloo, but also the lead investigator on the International Cannabis Policy Study, which some of you may have been seeing many papers from in the last couple of years, where they are evaluating the impact of legalization in Canada as well as in the US, using a very creative survey and linking it with information on markets and providing some very deep insights about how cannabis policy has been changing and happened to be on the ground before COVID hit. Professor Hammond's research has covered the areas of tobacco, food, and substance use, and he's been recognized with awards from the Canadian Medical Association, the Royal Statistical Society of Canada, as well as the World Health Organization. So again, very excited to hear his thoughts. And with the final panelist that we have today is Bernd Werse, who is a research associate and co-founder of the Center for Drug Research at Goethe University in Frankfurt, Germany, where he's been a research associate since 2002. He has conducted research on new psychoactive substances, drug trafficking, small-scale drug dealing, cannabis cultivation, open drug scenes, and drug and urban society for years, but recently has been engaged in research on the impact of the COVID-19 on drug services and people who use drugs heavily. As co-editor of the German Alternative Report on Drugs and Addiction and a board member of the European Society for Social Drug Research, he has a lot of insight of what has been happening in cannabis markets in Europe. So I am excited to have all three panelists with us today, and I would like to start with Judith and allow you to present some of your preliminary findings of work you've been doing on cannabis. Judith?
Okay, before I begin, I want to draw your attention to all the really amazing people that worked on this project, including Laura Garius, Jack Spicer, Magdalena Harris, Corinne Moore, and Neve Eastwood. So, for those of you who don't know, Release is a national centre of expertise in the UK regarding drugs and the law. And in mid-March last year, just as the pandemic was gearing up in the UK and in most other places, Release organised a network of drug experts in the UK, and we met weekly to share information about drugs in the pandemic. And I was one of the people in the network. And I jumped in to create a drug purchasing survey to assist Release in their market monitoring work. It was up and running, unbelievably, by the 9th of April. So things can go really quick when they have to, ethics and all. And only 17 days after the UK's lockdown. The survey was promoted in the early days by word of mouth and also on a really wide range of social media platforms. And here in this picture, you can see one of the paid for Facebook adverts that Release created. Because the survey is still ongoing, I think that it's particularly valuable because what it produces for us is information about changes over time. And because it asks respondents to report about a purchase, including the date that the purchase was made. We've got about 3,500 responses so far, but this analysis is based exclusively on 2,621 purchases. And as you can see here, it's a mostly youthful sample, mostly men, mostly white, and 1/3 employed full-time. We present most of our results for this research in 4 time periods that correspond to key pandemic-related dates in the UK. Purchases made in anticipation of the first lockdown, so that's before the 23rd of March, during lockdown, as lockdown began to ease, and then as the first national lockdown began to lift in the UK. But of course, as you can imagine, just like the rest of the world, it's worth recognizing that these were not in any way discrete periods. And in fact, we've never fully emerged from COVID-related government-imposed restrictions in the UK, and this remains the case now. And of course, we're still running the survey, so we should be able to see changes as they emerge. So 70% of purchases that were reported were for cannabis products, as you would expect. Now, it would have been ideal if I'd have removed the non-cannabis products from this analysis for the results that I wanted to present here today, but for one reason or another, this wasn't possible in the time that we had. However, you can see here in this next slide a breakdown of the types of cannabis. And this was mostly, although not fully, as we would have expected. And the particular difference was in connection to cannabis resin. Now, we know that cannabis resin is significantly less popular than herbal cannabis in the UK, but we were at least initially surprised by how low the proportion was. It was only 4%, which is lower than we would have expected. But it was supported by reports from Release's drug market monitoring network that was set up in connection to the pandemic, reporting with lots of reports of a scarcity of hash or cannabis resin. We had 3 indicators of availability in the study. We asked respondents for the purchase that they were reporting about. Did they find it more difficult than usual to find a seller? Did they find it more difficult than usual to find the drug they wanted? Or did they buy from anyone other than their preferred seller? Now, I think that there are 2 main takeaways from this slide. The first is that if you notice, the left part of the slide has the dark orange parts of the bar, and the right part of the slide has the light orange parts of the bar. And it's the dark orange bits that indicate availability limitations. So what we're mostly seeing here is that people were reporting that they didn't have problems accessing the drugs they wanted. I mean, there were problems, but they mostly didn't have problems. And the second takeaway is that the availability problems that did emerge tended to increase over time. And so they weren't, as we might have anticipated at the start of the pandemic, these availability problems weren't more likely during lockdown. They were more likely as lockdown began to lift. And what this suggested to us is that whatever problems that there were early in the pandemic with availability, these were more likely to be down to the risks associated with venturing out and making illegal purchases, buying and selling during lockdown when everybody was home, than later when availability problems are more likely to have arisen from actually more limited supply. We asked respondents for each purchase whether this was made on a darknet market or a crypto market. And what we found is that the vast majority of purchases, even during the pandemic, have still been made online, or sorry, offline. The black bits are all the offline bits. And this is broadly in line with what the Global Drug Survey, the GDS, also estimates for the UK. It's about 1 in 10. So what we see here is more evidence to suggest that even though there have been difficulties and the darknet did seem to encourage people, maybe have encouraged people, 13% of those who used it were first-time users, and 26% said that they planned to use it if they needed to. But mostly what we're seeing is that offline drug supply was incredibly resilient, the opposite of that during the pandemic. I want to turn now to drug price and drug quality. So first, drug price. If you look at the bars on the left, you'll see that most people paid the same price that they were used to paying before the pandemic. And where we did see differences, it was more common for prices to be higher than lower. But about 1 in 10 consistently across those time periods reported that they paid lower prices. And the other thing that we found regarding price is that higher prices tend to be reported more often over time, or more likely to be reported over time, particularly with lockdown easing and lockdown lifting. Again, we hypothesize that's consistent with supply shortages that began to emerge. And with drug quality, so if you look at the bars on the right, we find a similar pattern. Again, most people are reporting that the purity of the purchases that they're reporting about were the same as what they were used to. But by the time of lockdown lifting, we're seeing higher purity being more common than lower purity. So perhaps counter to what some people would have expected. And consistent with reports on the network that I told you about, the market expert network that Release set up, that some suppliers were responding to shortages not by bulking out products, but by increasing prices or reducing deal sizes. Now, the next thing I wanted to talk about was the interest that we had in whether drug sellers were trying to protect their customers and themselves from getting COVID using the sort of standard mitigation strategies. And in short, doing this was not at all uncommon. We found nearly 2/3 were keeping social distance during the transaction, and around 1/3 roughly of sellers were wearing gloves or wearing a mask or took different extra care with packaging or changed how they handled packaging. And this was particularly common in darknet purchases. And some of the quotes we had from open-ended questions were really interesting. For example, here referring to drop-offs at a distance and contactless payment. So in summary, we could summarize it with this sentence that while COVID definitely resulted in adaptations to practices that were involved in buying and selling drugs, the UK drug market, to the extent that we captured it in this survey, and certainly with respect to cannabis, it remained remarkably resilient in the face of what were obviously globally pretty unprecedented restrictions. And that's everything. Thank you.
Thank you very much, Judith. And my apologies to you and to David for the last minute change, because in my rush to get online, I didn't pull up the schedule. So I appreciate you going with the flow there. Our next speaker is going to be David Hammond, who's going to be talking about trends in cannabis use during COVID among youth and young adults in the US and Canada. David.
Great, thanks, Rosalie. And if the host could make it so I can share my screen, that'd be great.
And I'm going to be showing you just a little bit of data from what we call our International Cannabis Policy Study, a series of repeat cross-sectional surveys in Canada and the US, lots of methods and other details online. So let's first ask the question about how the number or prevalence of cannabis consumers has changed during the COVID period. And we'll start by looking at past 12-month use. And what we see is a fairly big increase from the year prior to a year after cannabis legalization in Canada, that then leveled off between 2019 and 2020. And by the way, the data collection for these years are in September and October. So 2020 would capture the first 7 or 8 months of the COVID period. When we look at daily use, we see something similar. We see an increase, but somewhat more steady across the 3 years. Now, we also have data that suggests that among cannabis consumers, the amount of cannabis they consume has increased. And I'm showing you data for dried flower consumption, the number of grams per day that consumers use on days that they use it. And what you can see on the far left is all consumers in Canada. We saw an increase from about just under 1 gram per day to about 1.12 grams per day as of September 2020. And if you break this out and look at the different sort of types or frequency of consumption, you can see that most of that is due to daily consumers. And this is consistent with sort of other national survey, which suggests that among established consumers, many report that they consume more frequently during the COVID period. But of course, the challenge we have in Canada is that the COVID period is right in the post-legalization period. And so it's really difficult for us to separate the effects of the pandemic from the effects of our legal retail market, which was being established throughout this period. So, for example, we've seen fairly dramatic changes in the types of products that consumers use across these 3 years. Some of these may be secular trends. Some of them are related to the schedule of when different products were legalized in Canada, and some of it may be related to COVID. For example, it's possible that some consumers wanted to avoid products that you primarily inhale, such as dried flower when it's smoked, for example. So where can we sort of separate the potential effects, the general effects of legalization from COVID-specific effects? Well, we have a youth survey that we've been conducting in 3 countries with 16 and 19-year-olds for the last 5 years. And we're fortunate that we had more frequent survey periods during the COVID period. So let's have a look at what we find. We saw a fairly steady increase leading up to and in the year following legalization. But what we saw is a break from that trend and a fairly significant decrease in past 12-month cannabis use among 16 to 19-year-olds in Canada. That's between February and August, so that would be about the first 6 months in the pandemic experience in Canada. Interestingly, by February 2021, we've seen sort of a resumption to trend. Now, as I mentioned, we also do this survey in the US and in England. And what we saw there was very similar trends. So again, England is lower, US and Canada is higher in general, but you saw the same decreasing trend in the first 6 months of the pandemic, followed by a resumption to trend. Now in the US, you can tell that they've stayed lower. At that particular period in February 2021, there were more school closures and lockdowns in the US than Canada. And we'll learn in August 2021 whether we see a resumption to trend as we've started to see in Canada. We also have some questions in our International Cannabis Policy Survey that is specific about the effect of COVID-19. So we ask consumers how it's affected their cannabis use or their marijuana use. And you can see that fairly low numbers, about 2% said they either stopped or started using cannabis because of the pandemic. About 7% of consumers say, yeah, I haven't stopped or started, but I do use less. And then you can see about 16% of consumers say, I use more. So that's consistent with the data I showed about greater daily use in terms of amounts. And as I said earlier, it's also consistent with other surveys where we see a reasonable number of consumers saying, it hasn't changed whether I use or don't use, but I have increased the amount that I use. It's also possible that COVID-19 has changed where people source their products. And so we specifically ask consumers, has COVID-19 affected where you get your marijuana? And the red bars here show you how many consumers say they were less likely to purchase from each source, the green bar more likely, and the gray bar no difference. And you can see that some people report being more or less likely for each. But you can see that the biggest effects is that about twice the number say that COVID-19 made them more likely to buy from a store, co-op, or dispensary. So that would be typically a legal source in Canada. And we can see an even stronger effect saying, yeah, I was more likely to source my products from the internet or through mail delivery. Now in Canada, internet cannabis sales are legal. In fact, in about half the provinces, the governments run the legal store. So that really changes the notion of access when we have, geographic shutdowns or lockdowns. And we asked a more general question saying, okay, well, overall, how has the pandemic affected whether you get your cannabis from a legal or illegal store? And we're seeing a similar finding here where far more consumers say, yeah, that COVID-19 made me more likely to buy from a legal store. And the reasons for that could be, you don't want to meet some person in the back alley when we're supposed to be socially distancing, that you can get cannabis online and delivered to your door during the pandemic, and maybe just greater confidence in legal sources during this period. Now, the acceleration of the transition to legal stores partly reflected just where we were at in legalization. So the number of stores per capita more than doubled over this period. But it was also likely a reflection of efforts to maintain access to these stores during the pandemic. So a number of provinces allowed curbside pickup, greater delivery options. For example, the provincial retailer in Ontario they waived the delivery fee, and it was essentially overnight delivery. So it's a combination of the establishment of the legal retail market in Canada following legalization, as well as efforts to maintain access to that. So by way of a quick summary, the impact of COVID-19 on cannabis consumption in Canada is likely very individualized. So among youth, it looks like it decreased consumption, probably because youth don't have the same social sources. It's not as fun to smoke a joint on the back deck with your mom or your uncle as it is, with your buddies. Among adults, there may not have been a dramatic increase in terms of the number of consumers, but we have a fair proportion telling us that they consumed more. But as I've said, there's a real challenge of differentiating the pandemic from the impact of legalization, layer on top of that secular trends. And I think we're going to learn a lot more about the impact of COVID-19 over the next year or two, where we can see, for example, in youth prevalence, whether we see a resumption to trends or a longer-term impact. So thank you very much. Again, great to be a part of the session, and I'd be pleased to answer any questions.
Wow, thank you, David. That was terrific. And I didn't know it was pre-recorded, so that was surprising. Very good at technology there.
Oh, it's just so my kids don't come shouting into the background. So thanks.
Very good. Well, thank you. And our final speaker, final panelist is Bernd Werse, who's going to be talking about cannabis availability and use in Germany during COVID-19. Bernd?
Okay, so here's the title page. Yeah, thank you very much for being part of this webinar series. And I think it's quite interesting that everyone asks questions differently about availability and use of cannabis during the COVID pandemic. What we did is two small online surveys for people who use cannabis. The first one was also quite early in the first lockdown period between April and June last year. And it was like we wanted to have this subject researched immediately when it's a current topic. And so we did a really short survey, and it wasn't not very much elaborated, but we managed to get more than 1,100 participants. And then we did a second survey from January to March this year, where we managed to get more than 3 times of participants, like 3,460, and that was mainly due to this guy who you can see here in the on the screen, who's the main cannabis policy reform activist in Germany, and he does some video news. He is the chair of the so-called German Hemp Association, and his weekly video news, there are like 50,000 to 150,000 people who watch this each week. So he promoted it on his video, and so we managed to get quite many participants. But we also, of course, did some announcement in social media. And both the surveys were conducted without any funding, so it was quite low level that we did here. In our survey, we have even higher percentage of male respondents, like 91%. The average age was at a little bit below 30 years. What's quite interesting is that we had a relatively even distribution regarding rural and urban regions. So many people also who came from the countryside. But since this survey was directed to people who use cannabis, who at least occasionally most of the people who answered the survey were quite frequent users. Particularly the ones who are watching these cannabis policy video news each week, many of them are frequent users. In the first survey, there were 51% daily users and 28% who use several days a week, plus 10% once a week, and the few others were less frequent users. In the second survey, it was a little bit different, a little bit less of daily users, but quite similar to the first one. When we look at what the people were telling us about the development of their cannabis use, already in the first survey during the first lockdown, 39% stated that they have increased their use since the beginning of the pandemic. In the second survey, we asked for 3 different periods: for the first lockdown, for the intermediate period, and for the second lockdown. And as you can see here, there were in each of the periods, there were much more people who said that they have increased their use than people who said that they have decreased their use. And what was quite interesting in the last period, so in the second lockdown, the number of those who said they have even more increased their use has also increased, but also the number of people who said they have used less in this period. So, I mean, overall, we can see a clear tendency to more use among those who are already regular users. And when we, in the second survey, we also asked directly, what was your pattern of use before the pandemic and what's your pattern of use now? And it was mainly daily use, which rose from 38% to 47%. And these were mostly, before these were mostly weekly, but not daily users who switched to daily use. So very few occasional users who were using more in times of the pandemic. We also use the people who have increased their use at least once during the pandemic. What were the reasons for their increases? And the 66% said to enjoy their additional leisure time. 61% said to alleviate stress. So there were 46% out of boredom, and some others who said unconsciously out of the new habit they have developed, and also a few who said that they wanted to fight fears, or so COVID-19 fears or something like that. And what was also interesting is that those who worked less than usual and those who were primarily worked in home office were more likely to have increased their use. So on the one hand, this was probably due to this additional leisure time, and on the other hand, perhaps a little bit because of more stress when they were at home, coping with homeschooling and all the other stuff that you have to do at home during the pandemic. So much about the use, but we also had some questions about availability. In the first survey, there were 47% who said that the availability has decreased since the beginning of the pandemic, while only 1% that it had increased. In the second survey, it was slightly changing. Also, we were also asking how has availability changed since the beginning of the pandemic, and there were 40% who said that it decreased, but a little bit more, like 5% who said that it increased during the pandemic. We, after the first survey, we expected that might be, in rural regions, it might be more difficult to get cannabis because people have usually less opportunities or less people they know where they can buy from. But this wasn't the case. In the second survey, we were also asking about the place where they live, and there were no significant differences between rural and urban regions, and also no significant differences between the different federal states in Germany, which are quite different in terms of drug policy. A majority reported no changes in prices, but the other 40%, most of them reported an increase, on average 2.5 euros per gram on average. Other than or different from what Judith has told us about their UK survey, there were barely any people who said that the price has decreased during the pandemic. And even among those who reported lower availabilities, more persons said that they increased the use compared to those who decreased use. So it was not really a reason to use less when the availability was limited. And in the next slide, we can see what might be the reasons for that. We asked the people who have stated a lower availability, have you taken any measures to compensate for the lower availability? And 45% said yes, they were stockpiling, they bought more at once or substantially more at once. 40% have been looking for an additional or an alternative supplier, and obviously were quite successful with that. Only 24% said they didn't take any measures. 12% said they were home growing, or they were home growing more than they did before, and only 6%, which was quite a low number, said they were turning to the online market, which is completely illegal in Germany. So, and when we also look at the general distribution of sources for cannabis, 42% say they buy mostly from private dealers, 38% from friends, like social supply, 10% are home growing, only 3% usually buy online, and 2% on the street or from abroad, from the Netherlands, where you have factual legalization in regarding cannabis. So a few words about conclusion or discussion. I have to point out that the main limitation is that these results are valid for regular cannabis users, or the vast majority were really regular weekly cannabis users or even daily users, not occasional users who are usually the majority of users. Although the biggest group did not report changes in use, there is a clear tendency to an increase. The motives for increase are diverse, from rather positive motives to rather negative or coping motives or something like that. A substantial group reported a lower availability, but most of these people were able to compensate with stockpiling or additional suppliers, offline suppliers. If in the future we want to do some additional analysis regarding the impact of other personal features on the issue, and we will also have some evidence from a representative sample of young people, of adolescents, so people where also occasional users are included. So that's it from my side. Thank you very much.
Thank you. I'm already getting excited thinking about the interesting comparisons and contrasts across the three studies. So I'm hoping that all the panelists will join. I don't see any immediate questions, so I'm going to go ahead and jump in. One of the first thoughts I had listening to Bernd when he was talking about changes in use, and it was clearly an increase in the frequency of use, it seemed, although these are regular users, because you mentioned more people are switching from weekly use to daily use. Dave's results for Canada strongly showed an increase in the amount consumed, right, Dave? So I'm curious how much we expect in Germany the change is also reflecting an increase in the amount consumed, not just the frequency of use. Well, were you able to investigate that at all?
I'm not really sure, but I'm afraid that we didn't include a question on the amount that the people have used. So sorry, I can't say anything about that.
No, that's all right. I mean, it's also something that's difficult to do on an online survey, so completely understandable. Dave can tell you the difficulty in trying to get accurate information on an online survey related to the amounts. But I think that one of the things that would be interesting to see coming out of COVID is if we do see a change in or a consistent change in the amount as well as the frequency of use among more regular users, because that can have important implications. Neem, I see a hand up. Did you want to say something?
Yes, thanks. So I was just really interested in some of the data that was presented, and I know very little about this area. And so I had a couple of questions, if that's okay. So one was just around about this whether that there was the possibility, and sorry if I missed it, but I know that you talked about different effects in different subgroups depending on their level of consumption. But I was wondering if you were able to analyze in any of the work that the panelists have done effects in different population groups. And I appreciate you only had 7 or 8 minutes, so you may not have had time to present that. But I know that in alcohol, we're seeing probably more women drinking more. We're seeing, you know, different socioeconomic differences in terms of the patterning of changes in behavior. If you could say something about that, it would be really interesting.
I can say a few things if it helps. The short answer is that I think that would be my overall conclusion, which is there is no one constant effect across the population. And as you said, we've seen different effects for things like smoking tobacco, alcohol, vaping, and e-cigarette use. There are differences by age. So we've generally seen reductions among younger people, probably due to more difficult access, fewer social interactions. We know those are important sources for where people get products. We've seen adult consumers, on balance, report increases in consumption. As you said, you know, a lot of these disposable income, for example, you know, that's really important for tobacco. Well, some folks have more disposable income in countries like Canada and the US. Some folks have a lot less and have, you know, lost employment. And so these are all background factors. You know, mental health, you know, I think on balance, it's been a period of increased challenges to mental health. There are some folks, due to changes in job, who have found that they can work from home, et cetera. So I think it's like the experience of COVID itself. It's been a very individualized experience, and that's played out different ways. And, you know, we are seeing some consistencies across different substances. Fortunately for some things like smoking, we see continued steady declines, whereas more novel products like e-cigarettes, vaping, and some aspects of the cannabis market, we've seen more changes. So anyway, all that to say that I very much agree that it is it is maybe more so than usual. It's played out in different ways for different subpopulations.
Any other comments from the other panelists on that?
Our survey was a transaction survey, so we were not getting that much information about use, but I didn't present a slide that I had on people just self-reporting whether they thought that their use had increased, decreased, or stayed the same. And it's remarkably similar to what the other 2 surveys seem to have found. We found 43% increased, 36% stayed the same, and 21% reduced. So yeah, that sounds not dissimilar, at least, to what the other studies have found.
I just wanted to say, as I have shown, we have very huge overrepresentation of male respondents. I don't know if it's a German speciality, because we also participate in this global cannabis cultivation research consortium, and there's also always like that we have the highest rate of male respondents. I don't know if it's a cultural thing that in Germany men are more likely to be frequent cannabis users. I mean, in lifetime prevalence, we don't have so big differences between the genders, but that's the reason why I can't say anything about differences in the development of women and men in their cannabis use.
I think that's a very astute point. How we generate these samples could be reflecting the findings that we have from them that are very important to understand in terms of sort of generalizations we should make from them. We had a related question in the discussion from Rachel Berry, who was asking about whether changes in amounts consumed or frequency is consumed, it has any implication about the amount of potency being used or consumed. I know, David, you did some work looking across products. Is that something that you might be able to speak to?
Yes, I mean, it's so difficult in this market, and I'm mainly speaking from the North American perspective of talking about secular trends, because the market has been evolving rapidly. And the way that I think about it, and the way that I think our general findings suggest, is that some of these changes in products are being accelerated in markets that have legalized non-medical cannabis, but they're present across. And, you know, like other jurisdictions, the average THC concentration in dried flower in Canada right now is about 21 or 22%. So it has gone up a lot. And, you know, it will settle at some point, probably in the mid-20s soon. But that obscures the even larger differences across product categories. So your average vape oil is about 70% THC, solid concentrate around 90%, hash 30-40%. And we have seen a bit, you know, we've seen increases in those, I'll call them other non-dried flower products. The big question is how people titrate or compensate. So if they're using a vape oil at 70% THC, as opposed to vaping dried flower or smoking it, to what extent do they adapt their intake and how much they inhale, such that it, you know, they're actually taking in similar levels of THC or not. So for me, it's the shift across product categories that's most notable in terms of potency. And we're starting to look at some interesting differences about, you know, we often focus on what product have people used in the past 12 months, but there are some products that are more common as a daily use. And so, you know, edibles are going to fill a different niche for folks than oral oils, than vape oils. And so I'm not giving any sort of a concrete answer here, other than I think we are seeing general increases overall, but that predated COVID, that predated legalization, but it may well have sort of accelerated those trends based on what we're seeing so far.
Yeah, I agree. I think that there was a big trend in advance, at least happening in North America. Judith, I was fascinated when you look at your cannabis purchase survey, you show that there was 60% of the purchases for cannabis specifically that were higher strength and only 25% that was herbal low grade cannabis. Is this consistent with what you were seeing prior to COVID, or is this part of a trend? Can you speak to that?
I think that what we saw was consistent with what happened before, except for resin and hash.
Okay.
But high grade, very popular here in the UK. Oil and shatter becoming more popular, but not dominant. The less than, maybe not less than expected, but less than we would have previously seen of resin or hash probably resulted from the fact that this would be something that was an import, and so a lot of other products more likely to be available domestically.
Okay.
Perhaps I can add something about
Yes.
this. We only, in our survey, we only differentiated between weed and hash on the other hand. And it was just a little bit more people who said that hash was a little bit harder to get during the pandemic. So obviously the market, the import market has been impaired by the pandemic, but not so much as we would have expected. And different from what Judith said about the UK, the percentages for people who smoke hash in the last years have increased again, because the hash that's on the market in Germany is much better than it was some years ago, because the people in Morocco, where most of the hash comes from, have also adapted to the new situation with high grade or higher grade cannabis where they make the hash from. So it has had an impact on also what the people use.
Yeah, I think there's just been a large global trend towards more high potent products. We're also seeing it in Australia and New Zealand. So I do think that this is going to be one of those other difficult factors to tease out from the general market trends versus COVID-19. It's not clear if COVID-19 is accelerating things or if it's just part of the national transition. Neil, you have your hands up. I want to go ahead and give you an opportunity to ask your question.
Thank you very much for some very, very interesting presentations. I think about the situation in South Africa and wonder, because we haven't done as much research on the topic, but wonder about the differences that we've experienced with the changes and our restrictions and so on. I have some specific questions though. Firstly, the first question I have is to everyone, to give us a sense of whether with the increased use among certain people, there were increases in cannabis-induced psychoses. Is anybody tracking that, whether there's hospital data or emergency room data, which suggests that that's been a problem? And then a second question, should I ask one at a time or should I just ask all three and then
one at a time? I think will be easiest.
Okay, then three of you can answer.
Keep track of.
Thank you.
I have done some work on this first question, but I'm happy to hand it to the panelists to see if they have anything they would like to say first related to cannabis-related psychosis. Any work?
So we haven't assessed that ourselves, but I know that one of the benefits of legalization in Canada is that in Canada, it was a bit more planned than some of the US legal states. It wasn't the result of a referendum or a ballot initiative, it was the government. And what it meant is that Canada had more of an opportunity to plan some evaluation and a framework. And right now they're going through the formal evaluation of the first couple of years. And so as part of that, we have like hospital data, administrative healthcare data, and there is an indication that some of those things have been going up. Again, not specific to COVID, and possibly not even specific to legalization. One of the realities, and Rosalie will know this well, is that people think that you can evaluate the impact of legalization the week after it's been legalized, before any stores are open, before anyone's even purchasing the products. And that sort of reinforces the myth that you're creating a market rather than shifting a market in terms of its purchase sources. So there is a longer term trend in some increase in diagnoses and different hospitalizations, but I've not seen anything that's really compelling in terms of the specificity either for COVID or legalization in Canada.
I can say in the US, there's been some work done on this, and we actually have a paper under review right now at a medical journal where we look at the expansion in retail access in Colorado. Colorado is a state that allowed its local jurisdictions to determine whether they would allow retail outlets or not. First for medical cannabis, which occurred in Colorado back in 2000, and then for recreational cannabis, where stores started opening in 2014, although the law passed in 2012, as David points out. And what we're finding is a very strong association between the number of outlets and the density of outlets in Colorado for recreational stores and psychosis events, emergency department visits. It's a correlation, hard to determine causation because of concerns of aggregation, not specific to COVID. I don't know that we will see anything specific to COVID unless we can understand potency and the amount that people are consuming of high potent products, because consumption of a low potency product shouldn't be highly associated with any sort of psychosis unless it's a naive user. And so it's really going to be a function of what products are being consumed and how much potency people are being exposed to for those risks. You want to go ahead with the second question?
Okay, I thought Bernd was going to answer as well, but
sorry.
Not really. I just wanted to add that generally during the COVID pandemic, admissions for psychiatric hospitals have gone up, but also admissions for addiction recovery institutions have also gone up. But it's not necessarily linked to cannabis use, because people, you know, working in home office and homeschooling and stuff like that, and they are developing more problems anyway. So yeah, that's what I wanted to say.
Yeah.
Okay, so the other question was just about policy, policy implications of these findings that you're presenting. What are, maybe you can speak about them from each of your presentations.
Policy implications in terms of how COVID helped us assess what might be important factors in these markets, or because I think
implications for existing policies.
Yeah.
How should existing policy, are there any implications for existing policies, cannabis policies in your countries?
So I think that, let me start by
during COVID.
Let me try to frame this in two different ways, because I think COVID was a shock that affected the supply side of the market very clearly in creating a disruption in terms of access to some forms of outlets, not all stores. It depended on the jurisdiction, whether cannabis outlets were deemed an essential business or not. And I think Judith's research, as well as Bernd's on source of access of cannabis, will be helpful in informing what we know from that. And then the shock in terms of need or use of cannabis in terms of what are the likely implications for users. So let's start with supply, because I think that's going to be the most natural one. And I offer any thoughts or takeaways from the panelists on this.
Well, I think that what our study really showed, and I think probably all of our research, is just how resilient illegal drug markets are. Whether this applies to cannabis alone, not exclusively. And in other parts of the study that I didn't report today, we did see increased reports of people saying that they overdosed more often, or they engaged in risky drug using practices, sharing needles, for example. And a lot of them having more contact with the police, which we know stop and search, for example, in the UK went up. So police were, you know, if people were dissuaded in the early days of going outside, venturing out to make their purchases, it makes sense, because there was a reason to be afraid, and people were having more contact with the police and more harms as a result of what they were doing. And yet we're seeing, although we are seeing lots of changes and lots of modifications going on in what happened with COVID, what we're seeing is a resilient market. It just manages in all sorts of different ways to continue to deliver the goods, and in some ways to continue to deliver high quality goods to people who are using in sometimes different ways, sometimes more, sometimes less, sometimes just because the circumstances in which they use, the socially constructed circumstances, have changed. So, you know, they may be using different drugs in different ways. So the fact that the very thing that we would think would reduce supply didn't particularly reduce supply, or it may have done, but we still seem to find things get through. So I think it encourages us to think about, I guess, harm reduction in drug markets, thinking about how we can have policies that don't assume that, you know, making successful arrests of people who supply drugs or take drugs is going fundamentally to change anything, and in fact may have unanticipated harmful consequences for people who take drugs, and take drugs sometimes in ways that are more harmful.
One of the things, I'm going to turn to Bernd in just 1 second. One of the things I noticed in your study, Judith, that you showed a lot of people were not necessarily going to the darknet or to crypto markets in response to COVID in light of this. And then there was the statistic that 70% of the purchasers were for cannabis. And I do wonder, in the case of cannabis versus cocaine, heroin, other substances, the local availability, the ability for retail stores, whether they're medical or like, changing the need to go to crypto markets. And maybe the fact that we didn't see much of a shock in supply was because we had legal channels available that were not, I would say, domestic production and cultivation that enabled less disruption of the market versus transit cross countries that would be clearly became more disrupted because of COVID.
That may be the case, but I know that an EMC DDA study of cannabis sales on a crypto market during the pandemic, during the lockdown phase of the pandemic, showed increased use for purchases of cannabis specifically. And if I remember correctly, but I might not, it was for increased use of smaller quantity purchases rather than for larger quantity purchases, which fell. It's interesting, really, because cannabis dominates on crypto markets anyway.
Interesting.
Yeah, I mean, it's between cannabis, ecstasy type products and psychedelics, that takes us up to about 70% of all sales on those markets.
Interesting.
It tends to be for party style and or recreational drugs.
Great. Bernd, I want to give you a chance to speak to the supply side.
I can add something to the last discussion because we also did some research on open drug scenes, on people who use crack cocaine and heroin and all these drugs who were imported from abroad, and we didn't see any changes in availability. We didn't see any changes in use. So even these markets where people have to bring the drugs from far away didn't seem to be really impaired by the pandemic. So that was really a strange phenomenon. And the other thing is that I can just confirm what Judith's assessment. Yeah, I mean, in the first lockdown, we had closed borders in Europe. It was a situation that we didn't have, okay, except for the UK, we didn't have for many years. And we saw some impairment of the cannabis supply, but people were easily could easily cope with that. So they were just searching for another source, and no problem. So even if there was impairment, it was I mean. These markets can be disrupted even by really heavy disturbances. So yeah.
I'll just add quickly that you know, it's obviously a very different environment when you have federal legalization, but it's interesting to reflect how quickly changes in the law potentially normalize things. So we went from obviously, you know, arresting people to identifying cannabis as an essential service, an essential product. So they had special regulations to allow access to cannabis products. And unlike in the US, you know, we have state-run stores. So in some provinces, all brick and mortar stores and online are state government run. In my province, Ontario, the largest, it's the online store. So you had the government not only ensuring that people could access cannabis, one of the few products, along with other substances. And I think just even that experience really caused people to reflect about the role of these substances in our society, that we deem them to be essential services. But not only did they do that, but it was the provincial government that figured out how to deliver cannabis to your door within 24 to 48 hours free of charge. It was easier to get cannabis than it was to buy toilet paper for parts of the pandemic. So I think it really, to the earlier point, you know, at the discussion, the narrative about how substance use is changing in a pandemic and people thinking about why. You know, a lot of people still think about it as a recreational activity that people shouldn't do. When people start talking about mental health and income and what it means to lose your employment or be confined to your home and the role that substances play in that, I think it's part of a broader discourse in terms of the role of these things in our society, and I think ultimately one that will be enlightening for many people that have a more traditional view.
Which I think brings us to the use side of the equation. Great transition, Dave, in that drug use has historically been a kind of a social thing. You do with your friends at parties. It's not unlike alcohol. It's the people who drink alone that are perceived to potentially have a problem behavior if they're drinking a lot alone. We saw these increases in use in daily use during the cannabis. Largely likely to be in more isolated settings than in the past. Is that something that we should be concerned about, aware of? What sort of, is this a trend? Is this a change because of COVID that might lead some, not all users by any means, because I think it will remain a social thing once we can all get out. Should we be concerned about isolated use and potentially isolated heavy use?
I think so, yes. I think that solitary use is a risk, isn't it? And
for any drink.
To the extent that use is social, whether in party situations or in clubs, pubs, festivals, or just alone at home or at home with friends, not alone rather. Yeah. There's risk mitigation there provided by other people, and just people to kind of moderate, maybe not life-threatening risks, but just unpleasant ones. Mm-hmm. So to the extent that those kinds of things change, we should expect to see changes in harms, but also benefits as well. Mm-hmm. And one of the things we noticed in the release study is, although cannabis use went up, the use of, cannabis purchasing remained robust. Purchases of ecstasy just fell away. And in another study that where we looked at price per unit for a series of drugs through the pandemic, price per unit of MDMA fell, whereas the price per unit of, I think it was cocaine, increased, suggesting that there was actually a vast reduction in demand, which is consistent with, this drug that tends to be used in these kinds of ways is no longer in demand.
Mm-hmm. I think that's one of the things I hope to get to is price. Dave, do you want to comment to this?
Yeah, well, it's interesting. I also do a bit of work in food and diet, and there's another example of where people have gone in different directions. Mm-hmm. We call it the COVID-19 for the 19 pounds that we've added. But I think it has, I think that's one of the differences between youth trends and adult trends, which is established consumers probably did more. Folks for whom it was primarily a social, occasion type thing did less because there were few social occasions. And so that's why you see the real differences by age. But, from some of the qualitative research I've read and some of the work that we get back, I think it's also, like a lot of us, made some of those more frequent consumers who probably do exhibit more problematic patterns of use. It's caused them to reflect on their use. And so hopefully it shifted the narrative to what I think a lot of us talk about, but which is, again, a focus on problematic indicators rather than any use. And that becomes an even greater focus in a legal market, where the government itself has to focus on not reporting. We don't typically report, have you had any alcohol in the past 12 months? And so it's about shifting. And I think we've seen some of that in consumers themselves in terms of reflecting upon their patterns of use as we all sit at home and as, there are fewer distractions. Anyway, we'll talk a bit about price, but yeah, that's an area where we've seen major changes even in the legal market, never mind the illegal market.
Yeah, I agree wholeheartedly that this is just, I think, one of the big policy implications, going back to your original question here, is us needing to understand what use really is, what use matters. Any use is not likely to be what matters for policy. It's which products, because of the correlation to high potency, and then the amounts of those high potency products. And in the case of the US, to what extent is that a reflection of availability versus marketing? Because in the US, we do have marketing of these products. Bernd, did you have anything else you wanted to add on the use side? Because you had some interesting findings in your study for policy implications.
Well, it's just with regard to this solitary use to people who are using at home. It was I also wanted to confirm what David said. That's really we have a split. We also gave the people the opportunity to give some qualitative, some text answers, and there were some people who said, "Well, I'm very comfortable with that. I have more leisure time. I can have a smoke, and it's easy. It's okay like that." And others who said, "Well, I'm really prone to develop dependence and to develop psychotic symptoms, and so it's really a bad situation for me that I'm sitting at home all the time and I still have my cannabis available." So kind of the COVID situation has contributed to problems, definitely, but similarly that it has contributed to other mental problems, and so yeah, I don't see any policy implication, but I think one question that I would have to David is, do you think that legalization in Canada has gone too far? That it's too easy now to get cannabis or something like that?
Well, that is a great question. You know, I think maybe where that's most applied is with respect to retail store density, or how many stores you have per capita. And so, you know, there's this, I'll say, rush in the first 24 months to open enough stores so that it's you know, it's more accessible than the illegal product. Canada, most provinces are they're reaching that point now-ish. And we'll start to see if there's some overshoot, with the idea being that you're not just diverting people from the illicit market, but rather you may be promoting use. Now, Canada's regulations as a whole on most aspects are more comprehensive than the US states, especially with respect to marketing and advertising. But it's probably worth noting that we have federal legalization. Some things are federal, but provinces manage their own retail market. We have 10 provinces in Canada. And you can look at the different provinces, and I always say this to international folks, if you wanted to say, well, what are some more and less comprehensive restrictions, just look at our provinces, because our province of Quebec, second largest province in Canada, they have a minimum legal age of 21. It's 18 to 19 everywhere else. They have even stricter rules about advertising and marketing. You cannot sell a t-shirt with someone smoking cannabis in Quebec. They have all government-run stores, and they don't have that many of them. And notably, most people aren't aware, they have not sold any edibles, vape oils, or solid concentrates. And they will be selling some edibles, but no chocolates, no gummies, nothing that appeals to kids. They're going to be things like granola bars or something like that. And even after they sell those products, a maximum THC limit of 30%. That's a third of solid concentrates. That's less than half of vape oils. So if someone in another country, whether you're for or against, said, boy, what would be the most comprehensive public health framework for legalizing cannabis? I'd say go look at Quebec, because if you look at Quebec, they've had almost no change in prevalence before and after. They're the only province where it's stayed flat daily and past 12 months. They are way less likely to use higher potency products. And I don't say that to endorse it. I just say that there are different models in Canada, and folks that are interested in them might look at Quebec, because if you just looked at the outcomes themselves, you wouldn't know that cannabis was legalized in Quebec in 2018.
I think the point that you raised is tied to one of the questions, again, related to policy implications from COVID, and that is, you know, the lower potencies has less harm of risk of a psychotic event or even addiction, potentially. One of the questions that was raised in the Q&A was about impacts on treatment, which I think would be a concern if we see use rising during COVID. of cannabis. Is there a concern or any, I mean, has anyone seen anything about rising treatment admissions for cannabis in any of your countries tied to COVID? Or it might be that, you know, in our country, this data is not released yet in a timely enough fashion to speak to it for COVID.
I think in Germany, it's also the case. I just heard about reports that generally the demand for treatment for addiction and stuff like that has gone up, but most of them were going there because of alcohol and not because of cannabis. Yeah. So, but we are waiting for the data regarding cannabis.
Yeah. Okay, Neil, you had one more question. Oh, unless Dave, you wanted to add anything.
No, that's.
Well, I think we only have about a minute left. I was going to point out this question of prices, but I think we saw there was a rise in prices despite availability, even in Canada, where it had been provided by the government online. And although Germany was the one place where 50% said there was no change in price. So again, we have some heterogeneity across the markets, and I think that that's going to provide for lots of rich research to be coming out in the next 6 to 12 months to evaluate how these different markets, what can we learn from the different experiments in these different markets, and what are some important takeaways for policymakers as well as doctors and harm reduction folks. I will close it out there and hand it back to Neem. Do you want to say something for ICARA?
Just to say thank you again to everybody, and to you, Rosalie. I know that it's not been easy to join us this week, so we really appreciate your time. So, and I hope everybody enjoyed the session. Certainly fascinating and a really engaged panel. So thank you all very much again. Please do fill out our survey, which has just popped up, and hope everybody has a good weekend when it comes.
Well, and I would like to thank the panelists for joining ISSDP, and I would like to make a plug. Future ISSDP conferences, we are tentatively still holding our in-person meeting in November in Mexico, but we'll be accepting abstracts for our Moroccan conference in 2022, which will be June 2022. So please be on the lookout for those.
The University of Johannesburg, the future reimagined.